Thanks for listening to the Wild Health Podcast. For the foreseeable future, you're not going to hear our normal intro or outro here. We're going to be releasing episodes very frequently as things are changing. This channel will be used for a very specific purpose. Number one, to communicate with our patients. We're somewhat overwhelmed, and the more we can communicate breaking news and recommendations from us to our patients all at once, the better. So if you're a patient, we're here for you if you need us, but if possible, please tune in here so we can both keep you up to date and conserve our time for the most critical tasks. Feel free to share this with friends and colleagues as well. Number two, we've organized as a group. We have infectious disease specialists, ER doctors, critical care doctors, and in total dozens of MDs, PhDs, and frontline clinicians who are going to be constantly evaluating the news and emerging evidence. We're then going to summarize and translate that for you here every day on the podcast. The speed of change with the circumstances will make us look foolish at times, but we're committed to pouring all of our resources and energy into doing what we can to help and make a difference. You can also follow our updates at wildhealth.com or our Instagram account at wildhealthmd. And if you're a patient, we're here for you. Please tune in here for the updates and let us know how we can help. Dr. Brian Adkins, thanks for joining us today on the podcast. We are getting a lot of questions about SARS-CoV-2 and children. So you and I together have seen exactly 0 children with SARS-CoV-2. So I want to preface by saying that we need to be really honest about what we know and what we don't know. But together we have seen thousands of children in the emergency department. We've seen thousands of cases of flu and cold, and you've been researching this topic and taking a really deep dive in it for us so that we could give really good information to parents who are scared. I have 4 kids. You have 2 kids. We want to know what we can do to protect our children. So I'm just going to start asking you some questions, and we should just start off general as well. And I've got some specific questions here that people have sent in. But first off, just tell me about the coronavirus and children in general.
Well, thanks first of all, Matt. Thanks for having me on the podcast. I'm a big fan of the cast, and I really appreciate what you guys are trying to do and bring to medicine. It's something that's long overdue, and it's very enjoyable to listen to. I'm honored to be on here talking about something as important to me as children. And so I do also, like you said, want to preface that not only have I and you never taken care of any patients with the COVID-19 infection, I would say also that there's going to be a lot of holes in the data that we find because children are not presenting as sick in general as adults. And so what information we have is brand new, it's pieced together, and it's rushed out to us as information is flowing in. So we'll try to preface that as well. When you asked me to talk to you about the coronavirus, everybody wants to talk about the coronavirus, and I'm sure you found this too. All your friends in the community and your colleagues want to talk to you about the coronavirus. Well, it's kind of interesting. Actually, you mentioned SARS-CoV-2. First of all, the coronavirus itself is a virus that most all of us have been afflicted with multiple times in our lifetime. The traditional coronavirus that we've been treating for years, and I've probably experienced multiple times myself if I've been tested with PCRs for it, is a common cold and congestion virus that has been a problem for us forever. So what we're trying to learn is how is SARS-CoV-2 different and what can it do. Coronavirus by itself is a relatively harmless virus, usually creating coughs and colds. There's data that suggests that coronavirus it could be cultured positive in 4 to 6% of children admitted with respiratory illnesses, and also 6 to 8% of those in the outpatient setting who get PCR testing. So the coronavirus itself is a common cold virus, and despite the fact that most individuals are exposed to it in their life over and over, seems to be no ability to gain complete immunity from this as different types of coronaviruses continue to cause people problems over life. One thing about coronaviruses that they've seen in hospitalized children in general is that they're more prominent, identified as a cause of agent of harm in children who have debilities or heart conditions, and they're also more common in children with chronic disease. Coronaviruses are also found to be, in general, common co-infections, citing that coronavirus is found when children are being treated for other infections on positive PCR tests at a rate of 11 to 46% when they are identified. And the regular coronavirus has a viral shedding for about 3 to 10 days. And as you and most of the listeners are probably well aware of at this point, that coronavirus includes a family that includes MERS and SARS as well as COVID-19. Interestingly enough, the traditional coronavirus, or the coronavirus in general, is a seasonal pattern, and usually get bad seasons with it every 3 to 4 years, and May to November is the typical time period whenever in some states, in northeastern states. So as far as how the COVID-2 is going to respond, or SARS-CoV-2, as we describe it, different from coronavirus, I did think it would be helpful to at least know a little bit about the fact that the coronavirus itself is a common pathogen that is typically not associated with severe illness in the United States, but interestingly enough, targets children with underlying conditions and heart disease whenever that does make them sick enough to be in the hospital.
So, Brian, what about general rates of infections in kids? I was just talking to someone this morning who he has a young 2-year-old son at home, and his wife is an ICU nurse, and by definition, we pretty much know she's going to be exposed to SARS-CoV-2 in the near future as more and more people are infected and our ICUs start to become filled with COVID-19 patients. And what I told him is that, so look, honestly, your son is at pretty low risk. The data that I saw coming out of China was that about 2% of the infections were people under 19, and as low as 0.2% of the critically ill. That was just one paper I saw, and I know you've been looking at this. Does that fit kind of other patterns in other countries as well, or what is the general kind of rates of infections in children?
Well, actually, that's a great question, and I don't think that we can give an accurate answer for the true rate of infection for SARS-CoV-2 in children. And the reason why is because testing is limited, and I believe that testing is primarily being done on people who are fairly sick and people who are presenting worried and with symptoms. And I believe that the majority of those tests are being done on adults. So I think it's probably going to skew the numbers to suggest that children aren't being infected. In one of the case series that I read that was gathered from the early Chinese data, it was Chinese literature, they suggested that the positive rate of testing was similar in children than it was in adults. So I think when we use the term infected, are we using the term infected and or being colonized by that virus or having that virus in your body, it depends on your terminology for that. I would say that without a doubt, the symptomatic patients who are presenting for medical care or symptomatic patients who are declaring symptoms, which you might say as the word infected, are predominantly adults. However, I have also read in one Chinese case series that they're expecting that the actual carrier status or the amount of children who are serving as a host is a similar percentage to the amount of adults in the population who are serving as a host. Similarly to to the rates that you described in China, we also are seeing a very similar rate of in less than 2% of identified infections in Italy.
And you say less than 2%. So, and just to be clear, when I say 2% infection rate, I don't mean 2% of children. I just meant 2% of those that had tested positive were under 19. So when you talk about that in Italy too, what is the number? I mean, the one study that I saw, or the one report I should say that I saw, was those under 19. How are they defining that? Is it a similar number?
Yes, they're
kind of teenagers and kids.
Yes, they're essentially doing the 18 and under for children. So in Italy, only 1.2% of people who presented for evaluation for illness were children. So I wasn't saying 1.2% of children. Forgive me for that. So I'll clarify. 1.2% of the patients who presented for medical attention who were tested were children in the Italy studies, and that's out of 22,000 diagnosed cases and 1,625 adult fatalities. They had identified only 1.2% of the patients who were tested who were presented for medical care among the pediatric population.
Yeah, and you make a great point earlier when you talk about it. It could be a much higher percentage that are actually infected. But what does infected mean? We're quote unquote infected with all kinds of virus and fungus and bacteria, but if they're not causing harm, then it's not a problem. And it seems to cause harm in a really low rate of children. Now obviously, I think we'll talk about this. I want to ask you about kids spreading it, so it's an issue there. But if we're just talking about the risk to your kid and not the risk to the general population, it seems that kids do pretty well, right?
Judging by what I have seen in the available literature, which includes papers that have come out just this week from the American Academy of Pediatrics and the pre-publication data in the journal Pediatrics, as well as the information that's been available primarily from the Chinese and Italian studies, what I would say is my overall assumption from gathering the data, and this is based upon still drawing some conclusions, is that the amount of children that are probably serving as a host for the virus is similar to the amount of the adults, but the amount of children expressing symptoms, hence seeking care and being tested, would reveal themselves to be a very, very small percentage of the population who are sick or identifying themselves as having symptoms in that under 2% range. But what you just asked about who is getting sick from it, I would say that, and I'm sure most of you have been watching the news, have identified, is that the rates of people who are actually getting symptomatic enough or getting very sick is tremendously in favor of children not getting sick. Children are not getting as sick of this as from this as adults are, at a staggering amount, actually.
Yeah, and it's interesting. I saw a report the other day of a child in Italy who had died, and they were kind of making the point that, well, hey, we can't say kids are safe, but it's really important to talk about actual numbers, just so that people can really assess risk. Joseph Stalin said, "A single death is a tragedy, a million deaths is a statistic." So when we see something like a child in Italy died, we get really worried, and that sticks in our mind because that's a tragedy. But the chance of your child being infected and having a bad outcome is really low. Shouldn't be the highest thing that you're worried about right now.
It's extremely low, and obviously the information that we're dealing with is very fluid. But what I'd actually read as recently as information from this week, and it must be a brand new case of a child in Italy, because at that point they had said 0 deaths in anyone under the age of 30 in all of Italy of 22,000 cases. So there have been 1,625 adult fatalities in Italy at the time that this paper was published, and 0 deaths under the age of 30. And I think there's only one documented child death in China, but I was not able to find information as to whether that child had pre-existing illnesses. So I would say that children aren't getting near as sick as adults, and so I would say that the risk for children from having a bad outcome from this virus would be substantially lower than most of the other risks that the child incurs in day to day. In fact, one of the most striking statistics that I saw was even during the time period of the epidemic reaching China, that they did a study of all the children who were actually admitted to Chinese hospitals, and when they looked at that, they found that only a small percentage of the children who were admitted to hospitals in the Wuhan province with respiratory illnesses were actually SARS-CoV-2. I think they identified it on 6% of the children, and they identified over twice as many cases of common influenza. So if that tells you, even during the time of the epidemic in China, that they took all the children admitted to a major pediatric hospital for respiratory illnesses and found out that more of them were admitted for flu and other common viruses than they were SARS-CoV-2. That, I think, gives you a good idea that your child's risk of flu or other illness causing them major harm is probably greater than COVID-19.
Yeah, and I just looked up that case I was talking about, and actually it was a 14-year-old boy in China, so I may have misspoke about that. So, but that just shows the number of infected and the deaths in China, and only one under 18. It just goes to show how low of a risk. But it's like you've said, Brian, this is evolving really quickly. Things are changing, so we'll keep updating you on those risks. What are the symptoms and clinical findings in children if they are infected with SARS-CoV-2?
Well, similar ones to what you might expect, which is a traditional cough and fever, I think, are the primary symptoms. They also mentioned that they found fever in one Chinese study. They found fever in 44 to 50% is what they assumed. 38% had a cough. They identified rhinitis, which is a runny nose, headache, diarrhea. Interestingly enough, what they found is that gastrointestinal symptoms, diarrhea specifically, is much more common in children when they present. So, and a lot of the children are asymptomatic. One study says 9 to 11%, another says 4%. But I would say that the reason that those children that identified is such a small rate of asymptomatic is many of the asymptomatic cases were never tested in the first place. And so I think you're going to basically be looking at the same symptoms as the adults have, which is your cough and your fever, but you're going to see a higher rate of gastrointestinal symptoms with them. And I also looked quite a bit about the workups, because I believe that the workups they're doing in the hospital to try to identify lab abnormalities, x-ray findings, and things that may not be pertinent to the layperson out there, but some of the things they were finding in children was very similar to what they were finding in adults. Slightly low white blood cell counts, a low neutropenic response, slightly increased LDH. They found that there's some x-ray findings and CT scan findings that were typical of the adult findings. And I found it even more interesting that they were doing CAT scans essentially of the chest on asymptomatic children and identifying on these children who had no respiratory symptoms or presenting symptoms to them or their parents, but identifying some of similar x-ray findings, the ground glass opacities, as they found on adults, but these children were still not having symptoms.
And you named a lot of symptoms there that people listening are saying, you know what, my kid has that right now. So we don't want to make people rush to the emergency department because your kid has these symptoms. Remember, very low likelihood of your child getting sick. And if you go in, please trust the pediatric emergency medicine doctor on. You and I have both taken care of adults and children, and the level of hysteria that tends to happen sometimes when your child is sick, and it's completely understandable. You and I have both had sick children, and we know that feeling. But at this point, with as much of this virus is going around, really think twice about taking your child in if they're doing well. Talk to your pediatrician first, and maybe don't go expose yourself and your child to the emergency department if you're not sick. Think about, if your child has a regular cold, your pediatrician feels comfortable they shouldn't go in. If you take them in and you expose yourself and your child, and then one of you all then infects someone who is at risk and an elderly, that's not a good situation. So we have to trust our providers at this point and use some common sense when talking about kids and when to get them checked out.
I think one of the most striking things, that just like you mentioned, Matt, is that taking your child to the hospital, that the coronaviruses as a whole are common co-infections, and so there's certainly no rule against them gathering other infections while they're in the hospital. And if you look at the fact that more children were hospitalized with traditional influenza and other viral pathogens during the time period of the epidemic in the Wuhan province, that should tell you that our children may be at more risk from other viruses that we deal with on a regular basis. So rushing them in for COVID testing whenever it is unlikely to cause them harm, it could place them at increased risk of acquiring something else. Or your child may actually have a cold, and by taking them in, you've exposed themselves to other viruses or the ones that you fear the most.
Yeah, I think in general, if you wouldn't take your child into the hospital 6 months ago, then probably not a reason to take them in now.
I think that's probably the best advice I could give, is that if you have a reason to be concerned that based on your child's breathing patterns, activity levels, eating, that you would have thought 2 months ago, I should take them to the hospital. They could have a secondary pneumonia. They could need breathing treatments. They could be in a very difficult and precarious situation. Then I would use that same level of judgment as to when your child needs to be evaluated. If it was a respiratory illness, or that you would have typically been okay with waiting out at home, then I would think that this, even in the current climate, you should probably exercise that same judgment now.
So if these kids aren't getting as sick, Brian, why are we closing schools?
That's a question that I've probably gotten more than most, which is that why are we closing schools? Why are we closing down activities? I got an email yesterday from an educated person in a non-medical profession who was essentially trying to start a passionate conversation on email about how ridiculous it was that her son, who's graduating high school, would be kept away from his friends in his senior class at the end of the year. And really the reason that we're closing schools is it's a public health concern. I believe that if we had a way to study it and measure it and we had great data, we would know that as many children are carrying as hosts these viruses as adults. And so they're not getting as sick, but that doesn't mean that they can't transfer the infection. In fact, children are great vectors of disease transfer. I have a 2-year-old and a 6-year-old, and they mean the absolute world to me. But I work in an emergency department and take care of other people's sick children for years, and I never got sick. And then I had my own children, and now I stay with a respiratory infection at least, it seems, 4 to 6 months of the year. And the reason why is because I spend a great deal of time around vectors of infection, which are children. They're carrying infections into our house and transmitting them. And so by getting children together in school and the amount of time that they spend not washing their hands, touching each other in close quarters and in close contact, we're spreading that virus throughout the school, and we're taking it home to people to spread to them. And so the main reason for the school closing is not out of concern of the children getting a cough or some children being asymptomatic. The concern is to the grandmother at home. It's concern to the sickly father at home. It's concern to the pregnant mother with diabetes that's in their home. And it's concern to the janitor, the school teachers, the principals. And so the decision to close school is not based upon the welfare of the children specifically. It's based on the welfare of the community.
Yeah, you mentioned a pregnant mother. We're actually recording a podcast with one of our OBGYNs we'll release here in a few days on pregnancy and COVID-19, or if you're thinking about getting pregnant. But yeah, I mean,
I think a lot of people are thinking about getting pregnant right now during the quarantine, Matt.
Yeah, that's a good point. And if we have to talk about flattening the curve one more time, I think I'm going to go crazy. Hopefully people understand that concept now and why it's so important. I read a really great email from Dr. David Sinclair a few days ago, and we're actually going to interview David and post a podcast with him because he got a great perspective on this and just a really good analysis of everything. So that's going to be coming out in the next couple of days as well. Now, if your child actually is infected, and let's say they're one of the rare cases that they are kind of sick, how is this treated in children?
Well, I think Americans right now and people across the world are trying to figure out how to treat this virus in general. And there are a lot of theories, and as a fan of your podcast, I'm aware of what you guys have been talking about already. But I think that probably to answer it succinctly, I would say that the way that this virus is being treated in children is supportively. I would say that the fevers are being treated with antipyretics, that respiratory symptoms and cough are being treated with suction, etc. Basically, things that could make them feel better. Older children maybe even cough and cold medicine. But I would say that in general, the treatment for this is primarily supportive. Now, couple of interesting things that may fall out of the realm of what may be different would be that there is concerns that by certain people that including the French foreign minister and some comments by the WHO, that children or that people in general should not be treated with ibuprofen, suggesting that anti-inflammatories such as ibuprofen and steroids may actually have a negative effect with regards to your body to fight this infection. So I would say that based upon the information that we have, I don't have a strong reason to believe that ibuprofen would be harmful to your child. But I would suggest that Tylenol would be if my child were to come down with a respiratory infection that I was concerned for some reason was SARS-CoV-2, I might lean toward Tylenol as my primary antipyretic of choice, whereas I typically would go with ibuprofen. So I think that there is some caution with ibuprofen. I think that most of antibiotics, obviously, this is an audience, I'm assuming already knows this, but antibiotics are obviously not going to help during a virus. There is some thoughts that antiviral medication could be helpful in people who are critically ill or people who might become critically ill with this. And in fact, there's Chinese case studies of treatment with typical antiretroviral medications that are part of the drug therapy that are given to the HIV virus, but they did not list whether these children got better quicker. They just commented that they were used, and so there are some inhaled anti-inflammatories and alpha inhibitors. But I think in general, what I expect to do for my child, if I believe that they've come down with a contact and a respiratory illness of SARS-CoV-2, is supportive therapy with Tylenol as my first line agent for fever and the traditional things that I would do to support their respiratory status.
Yeah, and it's really important to state that there's no FDA-approved treatment for this. It would be irresponsible to recommend specific treatment, but yeah, same thing you do for any virus, supportive care. There is really interesting evidence about Plaquenil, hydroxychloroquine, and there are pediatric dosing for that if it turns out that that's useful. And we've talked about that a lot, and I appreciate how you talk about it in terms of what you do for your child because, yeah, I've got 4 kids. I'm thinking about what I would do for my children, and if one of my children did get it, I agree. I don't think at this moment in time today, I would not give them ibuprofen. I would go with Tylenol or acetaminophen. I like the evidence around hydroxychloroquine. I think zinc is also not a dangerous supplement in general, and there's a few other things. I don't think there's many changes to treating kids as adults. We'll find out soon. We're watching that evidence very closely, but we're not recommending anything. This is not medical advice, period. We're just talking about the emerging evidence and trying to keep people as informed as possible.
Absolutely. And I wouldn't certainly advocate anyone seeking antiretroviral therapy like they were doing in China from their children or specifically doing that. If you have a concern, if your child comes down with a confirmed case, and certainly there are some things you can speak with your physician about, but I expect that most of the people listening to this cast will fortunately have children that if they do come down with the virus as a host will either be asymptomatic or have mild symptoms, and they'll have the hopeful luxury of being able to provide them supportive care at home. And in that setting, then I would think that the wisdom would be with what you said, Matt, which was utilization of acetaminophen as the primary fever and pain agent and general supportive care.
Yeah, and it doesn't, what we normally do in medicine doesn't change the situation, which is anytime we're thinking about doing something, it's a risk-benefit equation. We always want to do something, but anything we do is going to potentially have some side effects and other downstream consequences. So if the benefit of doing something is so low, which in this case it is because these kids do well, then it doesn't have to be much harm in order for that harm to be higher than the benefit. So kids in general, I'd say, yeah, we're going to, number one, do nothing, let them get better. Number two, just supportive care, and then let your physician make a choice about anything further than that, for sure.
You've expressed that better than I ever could, which is most of the really out there early adapting experimental treatments are not what I'm going to be pursuing for my children because I expect them to have minor cases. In fact, the main therapy I'm going to give for my children is to keep them away from their grandparents.
Mm-hmm. Yeah, exactly. What do you tell your kids, Brian? We have kids. This is not something that they're not going to hear about. They're not going to school. They want to know why they're not going to school. They want to know why they can't play with their other friends and go to birthday parties and all these things that they feel like are devastating to them. It's difficult for kids. How do you talk to your kids about this?
Well, what I've told my children is that if I can go without March Madness, then they can go without birthday parties. And no, I'm just joking. Of course, I haven't told them that. Although my 6-year-old did give me a hug the other day and tell me that she's sorry that I missed my favorite event. And so I thought that was pretty mature of her. I think what you tell your
was that the NCAA tournament or the SEC tournament?
Well, I was going to take her to the SEC tournament, and so she was disappointed because she wanted to go there. But I didn't take her to obviously she was disappointed we didn't get to watch the NCAA tournament together. But I would say that obviously how people choose to talk to their children is variable per family, but there are certain things that probably consistent among families, which is we want our children to be aware. We want our children to have good information given to them. We want them to not be anxious, and we want them to be able to learn to help themselves. And I think that's probably universal. And so what I would recommend is what you would do most of the time on a healthy, most of the time to keep your children healthy. I'd recommend a healthy diet. I've heard people say obviously boosting your immunity with good foods like crucifers. Of course, that's something you should be doing all the time. Exercise is still going to be important even under quarantine. There are ways to find exercise in your home and outside of your home in order to try to keep your children active and keep a good immune response